Hello everyone, welcome to my presentation on penile cancer. Risk factors for penile cancer include human papillomavirus, or HPV, and it's responsible for 40% of people that were diagnosed with penile cancer last year. It's a virus that's passed from skin-to-skin contact, and researchers believe that it is also linked to vaginal and cervical cancer in women, and also anal cancer in men and women. They create small little growths in the infected area and can be cancerous. Another risk factor is not being circumcised. Circumcision is the removal of foreskin, and research has shown that children that are not circumcised are at much less risk of penile cancer because they're not susceptible to developing a condition called phimosis and cannot accumulate a material called smegma. Phimosis is a condition where the foreskin becomes tight and difficult to retract. One way to prevent this is to pull the foreskin back and clean routinely. Smegma is a whitish substance that is a combination of oil secreted from the skin, bacteria, and dead skin cells. It can cause inflammation and irritation that can lead to cancer. Smoking exposes the body to many cancerous carcinogens that are dispersed throughout the body in the bloodstream. Smoking can also increase the chances of getting HPV as well. Next, people that have psoriasis have to get UV light treatment, which exposes their whole body to this type of radiation. They found that this increased chances of penile cancer, so since then, patients have covered their genitals. Finally, AIDS can be a risk factor because researchers believe that the weakened immune system response cannot fight off cancerous cells. Symptoms for penile cancer include redness of foreskin or penis, rashes on the head of the penis, foul-smelling discharge, pain, ulcers or lumps, swelling around the end of the penis, a change in color, and again, phimosis. The first symptom to show up is usually a change in color or thickness of the skin. Along with that, ulcers may begin to form around the glands that are located under the head of the penis. The rashes are usually a velvety red color, and in case of flat growths, it can even be a bluish brown. There are about 4 different treatment options that you can pick from depending on what stage your cancer is in. The most common treatment for penile cancer is surgery. It can range from removing the tumor by cutting away the cancerous cells under a microscope, all the way to amputation if the cancer is spread through the whole penis. Topical therapy is usually used if they catch the cancer in really early stages in combination with light surgery. Radiation therapy is used in combination with surgery, most of the time to prevent any reoccurrence of the cancer cells from coming back. Lastly, chemotherapy is used when the cancer has started to spread throughout the body. This usually occurs in the later stages of cancer. It's important to note that each treatment type has its own side effects, so it's important to talk to your doctor to get a second opinion and weigh your options. These side effects may include pain, nausea, vomiting, fatigue, anemia, and possible infection. When it comes to prevention, the best thing that you can do is to avoid all known risk factors, which once again includes avoiding HPV infections and smoking. There are 2 main factors that contribute to increased risk of getting HPV, and those are circumcisions and how many sexual partners that a person has. Research has found that men that have not been circumcised are less resistant to infection and are more likely to stay infected longer. Usually, the risk of being infected with HPV is linked with how many sexual partners that a person has. Next, keeping good hygiene is also an important part in preventing penile cancer. Uncircumcised men should retract their foreskin and clean the entire penis every time they shower. Penile cancer is a very rare type of cancer in the US. It occurs in less than 1 man per 100,000. It accounts for less than 1% of cancers in men in the United States, and it's more common in ethnic groups that are uncircumcised. If you look at the graph here, HPV-related penile cancer is most common in Hispanic men out of all the other ethnicities in the US. These numbers are per 100,000 men, So the next highest ethnicity would be American Indians and Alaskan Natives at 1 male per 100,000. After that, it's African American men, white, and last is Asian Pacific Islanders. In fact, penile cancer is a rare form of cancer in most developed countries. In Australia, it's 1 in every 250,000. Denmark, 0.82 per 100,000. In the UK, it was fewer than 500 every year. And in Israel, it was zero point 0.1 per 100,000. But in developing countries, it's more prevalent because circumcisions are less common. For instance, in Asian, South American, and African countries, penile cancer accounts for up to 10% of malignant men. If you would like any more detailed information, feel free to visit any of these sites, and thank you for watching.